And what does it do to the brain? Well, causes you to feel good, gives you a sense of euphoria, makes the user want more. That's how addiction starts. That's how craving starts. It just reinforces the fact that, wow, my brain really likes this, and I'd like to feel this some more. Let me talk to you about the THC levels in marijuana today as we were discussing the potency of it. Back in the 70s and 80s, it ranged from 3 to 5% THC. 3 to 5%. Today, it's not uncommon to see 15, 20, even 25 and 30% THC. So that is a huge increase in the active ingredient, the ingredient that causes the euphoria. And so anytime you increase the potency of a drug, what do you increase? You increase its potential to cause addiction. And so this idea that marijuana is not addictive is false. It absolutely does. And we're going to talk a little later about how it does that. It is the most commonly abused illicit substance in the country, and 40% of Americans have tried it. It is also the drug that accounts for the most treatment admissions in programs like South Miami hospitals across the country. So adolescents who are addicted to a substance are more often than not addicted to marijuana. And I will tell you that this has absolutely been my experience as I've been working in this for many, many years. The #1 drug of choice among the kids that we work with is marijuana. We have kids that smoke it every day. We have kids that smoke it multiple times a day. We have kids that smoke it in the morning and before they go to bed at night. These kids are absolutely addicted to it. They have become dependent on it. And in many cases, they cannot stop without treatment. And that's where programs like ours can come in and help kids and families to treat those youngsters. But it's definitely a huge problem. I will tell you that in this area, the thing that I battle the most is probably the attitude that people have about it. And I'll tell you, adults. I go out to community organizations, to schools, I speak to parent groups, and you know what I hear from parents a lot? I hear things like, well, I smoked marijuana when I was younger and I turned out okay. I hear things like, kids are going to experiment, this is what they do, it's a phase, he'll grow out of it. I hear other things like, it's okay if my kid smokes a little weed as long as he brings home good grades. I hear a lot of comments like that. And what I've come to understand is that in this community, and I have some theories about why it is, but I'll tell you that, this is Miami. Miami was built on drug use, if you really think about it. We have a lot of people in our generation, parents that are parents today, that grew up in the culture. And many of them did experiment. Many of them did use marijuana. Certainly many of them had friends and knew people who do. I see professionals today, doctors and lawyers, who smoke marijuana. It's not that uncommon. I really want to stress that. And so there's this idea that it's just, it's this harmless, benign drug. And that's why we're here today, because it's not. And it's a new marijuana. It's a more sophisticated marijuana. It's a more potent marijuana. And it's actually crippling our youth. And so I work with a lot of young adults as well. And I see a lot of kids 22, 23, 25 years old who have, in many cases, gone to great schools, graduated high school, even gone to college, maybe even finished college. But they're smoking marijuana, and you know what they're doing? They don't want to work. They don't want to go off and get their master's or go to some other graduate school. They want to sit at home and smoke marijuana and play video games. And there's a whole generation of these kids right now that is growing up, and they are completely unmotivated. They have lost interest in everything. They are no longer goal-driven. They really have become sort of kind of lifeless, if you will. And that's one of the things that I see with marijuana the most, is its ability to take away someone's motivation. That's one of the first things it does, especially in the adolescent brain. It takes away their interest, it takes away their goals, it takes away their motivation to do well in school, to play sports, to have other activities that they're involved in. The kids that we see in our program, that's the first thing that happens. They don't care anymore. They don't want to do anything anymore. And things that they used to enjoy, now they don't want to do those just alone. They want to do those high on marijuana. And so they begin to associate fun with getting high. And that is where addiction again starts to develop, and the brain starts to think that, well, I can't have fun without this substance. So let me talk a little bit about how it affects the brain. I think I mentioned before, it works on the reward center of the brain, the pleasure center of the brain. We call it the limbic system. It's that part of the brain that really anything you do it acts in that area. And so the dopamine is released. You feel good. In this case, over time, with any drug, if you release dopamine constantly because you're using a drug, what's your brain going to think? Well, your brain's going to think, you know, I got so much dopamine in there all the time, you know, I don't need to produce my own anymore. So it starts to shut down the parts of the brain that produce dopamine, and what you end up with is someone who now becomes depressed. They don't have their own ability to feel good naturally. They need this chemical in order to feel good, and so it starts that process of addiction for them. We have something called anhedonia that happens to a lot of people who use substances, including marijuana. And so a chronic marijuana user over time, and this happens to kids quite frequently, they sort of become, they have this inability to have fun without using the drug. It's this, they sort of end up bored with everything, nothing kind of excites them, nothing makes them feel good. The only thing that helps them to feel good is the drug. So that state of mind is obviously very dangerous for our kids. I talked about the heart rate. What's a normal heart rate? Anybody know?
80.
That's blood pressure, right? So heart rate 70, 80 beats per minute,
80.
right? When you smoke marijuana, remember I said it increases your heart rate. It can increase it by as much as 20 to 50 beats per minute. So immediately when you start smoking it, your heart is working faster than it has to. And if you think about it, if you're a chronic marijuana smoker and that's happening to you day in and day out, that's going to begin to wear on your heart, and it's going to lead you to heart problems in the future. Here are some other effects, and these are probably the ones that you may be aware of, but marijuana can impair memory, mainly short-term memory. It impairs judgment and decision-making. It disrupts coordination and balance. It affects one's ability to focus and solve complex cognitive tasks. The marijuana that we're seeing today is so potent that we have kids that have only been smoking, in some cases, a few months, that are already beginning to show signs of these impairments. You know, they can't think straight, they can't solve problems, they're not doing well in school, their performance is being affected. They're just not able to process cognitively the way they would if they weren't under the influence. And so that's really probably one of the most important things that we need to understand. The loss of motivation and the inability to experience pleasure is also an important effect of marijuana. Now, I talked about psychosis. There is a lot of data to also suggest that mental illnesses occur more frequently in people who smoke marijuana. Things like depression, anxiety, even schizophrenia. I was in Jamaica this past summer. I was speaking on behalf of the hospital to a group of physicians. And I had a psychiatrist there came up to me and was talking to me after my presentation. He was telling me that they had an unusually high rate of schizophrenia in Jamaica. And we were talking, and I was asking him, well, why did he think that was? And he told me, obviously, and I think we all know, that in Jamaica they grow marijuana. It's very acceptable among some people there. It's a huge problem from what this psychiatrist was telling me. And he was telling me that he thought that what was happening, and he was actually doing a study on this,